morning. We will discuss about the topic on alveolar bone. Alveolar process, it is defined as that part of the maxilla and the mandible that forms and supports the socket of the tooth. The main functions of the alveolar bone is that they houses the roots of the teeth, anchors the roots of the tooth to the alveoli, which are achieved by the insertion of the sharp-based fibers. They help to move the tooth for a better occlusion. They help to absorb and distribute the occlusive forces which are generated during the tooth contact. They supplies the vessels of the periodontal ligament. They houses and protects the developing permanent teeth while supporting the primary teeth. They organizes the eruption of the primary and the permanent teeth. So in these pictures, you can see that the blood vessels, it supplies the tooth, housing of the permanent tooth buds and the developing primary teeth and the permanent tooth buds, insertions of the sharp-based fibers. So the development of the alveolar process occurs by the end of second month of the fetal life. The maxilla and the mandible together forms a groove which are open towards the surface of the oral cavity. The tooth germs develop within the bony structures at a later period of cell stage. The bony secta and the bony bridges begin to form after that, and they separate the individual tooth germs from each other. They are outlined by bony compartments. Along with the tooth germs, the alveolar nerves and vessels are also seen. Prior to the root formation, the tooth germs within the bony compartment shows a bodily movement that shows both bone resorption and the bone deposition. As the root develops, alveolar process also increase in height. Later on, the dental follicle starts to differentiate into cementum, periodontal ligament, and osteoblast. The osteoblast forms the alveolar bone proper. So that is the alveolar process. They develop only during the eruption of the teeth. The alveolar process gradually gets incorporated into the body of the maxilla and the mandible. During the period of rapid growth, a tissue develops at the alveolar crust, which has both the characteristics of the cartilage and the alveolar bone, which are referred to as the chondroid. Alveolar process forms with the development and eruption of the tooth and diminishes in height after the loss of tooth. Then the structure of the alveolar bone. Anatomically, there is no distinct border exists between the body of maxilla or the mandible. So, as a result of its adaptation to function, alveolar process has two parts. They are the alveolar bone proper and the supporting bone. Then the alveolar bone proper has two parts as the lamellar bone and the bundle. We'll see each one in detail. The alveolar bone proper, it is 0.4 to 0.4 millimeter thick. They surround the root of the tooth and gives attachment to the principal fibers of the periodontal ligament. It partly consists of the lamellated bone and partly of the bundle. So the lamellar bone means they contains osteons, which have studied in the histology of the bone. That is, osteons means they have the circumferential lamina, and in the center you have the Haversian canal, consists of the blood vessels. The Haversian canal and the concentric lamina together forms the osteon or the Haversian system. The next is the bundle bone. Bundle bone is that bone in which the principal fibers of the periodontal ligament are anchored. The term bundle bone, mainly because of the insertion of the bundles of principal fibers of periodontal ligaments, they are known as the sharp-based fibers. In some areas of the alveolar bone proper, they composed mainly of only bundle bone. Twisting lines are also seen in the bundle. The bundle bone are formed in areas of recent bone appositions. The bundle bone are characterized by scarcity of fibrils. The fibrils are arranged at right angles to the sharp-based fibers. They are mineralized at the periphery, which are larger diameter. The fibrils, collagen fibers adjacent to the bone, they are less mature when compared to that of the adjacent to the cementum, and also they are less numerous in number. Then the fewer fibrils than the lamellated bone also. So, because of the scarcity of the fibrils, they appear darker in H&D sections. The pictures you can see these are the bundle bone. It's seen as darker in the H&D sections, while in the silver stains, they are seen as lighter in shade. Then the alveolar bone proper, they forms the inner wall of the socket, and they are perforated by many openings which carry branches of the interalveolar nerves and blood vessels into the periodontal ligament. So hence they are called as the cribriform plate. The bone between the teeth is called the interdental septum, and they are composed entirely of the cribriform plate. Then the interdental and the interradicular septum, they contain perforating veins, and the interradicular septum, they contain the perforating canals. They are the nutrient canals. These canals are called as the canals of gutter handle and purse. In the tribones, you can see the nutrient canals. So these nutrient canals houses the interdental and the interradicular arteries, vessels, and the nerves. Radiographically, alveolar bone proper, particularly the bundle bone, they are referred to as the lamina dura. In the radiograph, you can see the increased radio opacity. If the radio opacity means the radiograph, it is seen as a white line. So they are seen as an increased radio opacity when compared to the other structure. This opacity is mainly due to the presence of a thicker bone and does not contain any trabeculation. So this is not connected to the mineral content. This is mainly to the penetration of the X-rays. It is limited penetration of the X-ray, which gives the increased radio opacity feature. And next is the supporting alveolar bone. The supporting alveolar bone consists of the cortical plates and the spongy bone or the cancers. The cortical plate again consists of the compact bone. They form the outer and the inner plates of the alveolar process. They are much thinner in the maxilla when compared to the mandible. They are thickest in the premolar region and also molar region of the mandible, particularly on the buccals. In the maxilla, outer cortical plate is perforated by small openings, which carries the blood vessels and the lymph. Anterior teeth of both the jaws are very thin, and in there is no spongy bone, and the cortical plate is fused with the alveolar bone. Then the histology of the alveolar bone. The cortical plate consists of the longitudinal lamellae and partition. That is the concentric lamella and the partition canal. Spongy bone or the cancellous bone, they fill the areas between the cortical plate and the alveolar bone. Then they are surrounded by marrows, which are rich in adipocytes and mesenchymal cells. The condylar process, angle of the mandible, and maxillary tuberosity, they composed of hematopoietic cellular marrow. The spongy bone or the trabecular interior surface, they consist of osteocytes, while the surface consists of the osteoblast and the osteoclast. The trabeculae, they buttress the functional forces to which the alveolar bone proper is exposed. The cancellous components are more in the maxilla when compared to that of the mandible. So, by concluding this, they have seen in detail about the structure of the alveolar bone, the histology of the alveolar bone, the parts and the functions. And in the exam point of view, the alveolar bone is as such is an important question, and also the frequently asked question for the viva also, and also bundle bone is also an important question for your exam. So, thank you.